if you go back to early in the 20th century, radical mastectomies, Dr. Halstead, all the way through now to nipple-sparing mastectomies with a sentinel node biopsy, and even if your node is positive, you don't get an actual node dissection. That's a huge change. And then, of course, everything else as well. Radiation used to be, 6 weeks. Now we're looking at intraoperative single-dose radiation. Chemotherapy used to be weeks and weeks of terrible, feeling awful, being in the hospital. Now it's outpatient, women working all the way through their treatment. So we're definitely moving to a less invasive form. But interestingly, on the other hand, we're also finding breast cancer. We're sort of more aggressive about screening. So all of that works well for me. That all fits together. We're finding earlier disease. We don't have to be as aggressive treating it, or we can use more modern methods that are less morbid to the patient. I don't want to say less aggressive, because we are aggressive. We have tailored our treatments to be less morbid to the patient. Both surgery, radiation, and systemic therapy are all now much better tailored to be more tolerable by patients, and while still achieving better outcomes. So that's a good progression.